Filler fear. It's time to talk about this viral topic and a video, an MRI that's going around viral all over social media. You'll get to see this video which shows filler in the face, supposedly of someone who got just a few syringes over several years. But the MRI shows as if someone had dozens of syringes. And people are concerned that these fillers are multiplying or migrating or spreading and causing people's worst fears, which is that med spa face of stretched out, injectable, abused faces. And this is just not the case, and I'm going to tell you about it. First and foremost, as you all know, hyaluronic acid is a humectant. It holds water. So what you're seeing is a retention in water, obviously, in the area of the injection. Now, in terms of migration, filler doesn't just get up and walk away. You can get migration when you misuse filler. Remember my saying, you can't fit a size 4 foot in a size 3 shoe. So things can take the path of least resistance if you inject too much in the wrong place and use the wrong type of filler. But this MRI is giving the false impression that filler is a bad thing that stays in your body forever and just grows and grows and grows. And the fact of the matter is, it's not what you do, it's how you do it. We use fillers for volume loss. And yes, people should be cautious and scary for some of the work that's out there, because there are a lot of people that are using fillers thinking they're going to lift the skin. Filler does not lift. And there are a lot of people who don't have volume loss. Volume loss is just one part of aging, and some people have a greater component of it than others. The problem is that injectables are over-commoditized in the market, particularly in the med spa industry. So people, not me, inject fillers to treat just about everything. So it's good that people are having, a bit of wariness about this. But the fillers do serve a purpose. They're not going away. In fact, in my practice, we're seeing a rise of actually melting away older fillers. We'll get to that in part 2 of filler fear, how to melt away and reduce filler. But we're reshaping the face and kind of subtracting rather than adding to get patients to a cosmetically appropriate point where their faces don't look distorted. The important thing to remember here is that filler is neither a bad or a good thing. It's about choosing the right product, the right treatment for the right candidate. And if used appropriately, is still very safe and is part of an overall armamentarium of several options for patients to be the best version of themselves.